Under the needle, where acupuncture meets anatomy. Today, we're exploring small intestine 11, one of the most commonly used points in clinical practice. Small intestine 11 is located in the infraspinous fossa of the scapula, approximately 1/3 of the distance from the medial border. Palpation places you directly over the infraspinatus muscle, a key external rotator of the shoulder. This point sits in a mechanically significant region of the posterior rotator cuff, especially in patients with chronic shoulder instability or overhead loading patterns. Small intestine 11 overlies the infraspinatus muscle, which plays a primary role in glenohumeral external rotation and dynamic stabilization. Deep to this region runs the suprascapular nerve, originating from the 5th and 6th cervical nerve roots, supplying both the supraspinatus and infraspinatus. The suprascapular artery and dense posterior scapular fascia also occupy this space, making this region both neurologically and mechanically important. Needle depth and angle should respect the scapular contour and underlying neurovascular structures. Clinically, small intestine 11 is highly relevant in posterior shoulder pain, rotator cuff tendinopathy, and scapular dyskinesis. Weakness or inhibition of the infraspinatus often leads to anterior humeral glide and overload of the long head of the biceps. Additionally, weakness of this muscle can result in secondary impingement of the supraspinatus muscle at the acromion process. Trigger points in the infraspinatus refer to the front of the shoulder, outside of the upper arm, and into the forearm and hand. This can explain why posterior rotator cuff muscle dysfunction frequently presents as anterior shoulder pain. Traditionally speaking, small intestine 11 is indicated for shoulder pain and local stagnation along the small intestine channel. From a modern anatomical perspective, this region influences rotator cuff muscle function, suprascapular nerve signaling, and mechanical load distribution across the glenohumeral joint. When we integrate classical channel theory with structural anatomy, the point becomes more than a location, it becomes a functional intervention site. Understanding both models improves precision, reasoning, and patient education. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.